In the Christmas season, it's always a hassle to untangle lights. You can kind of guess where the female plug is and see where the male plug is and try to pull things apart. It reminds me of Clark Griswold in Christmas Vacation. But I'm doing this for a point because electricity will always flow in one direction. You just have to kind of sift apart, figure out where the voltage is going, and then you can plan to place the lights on the Christmas tree properly. Well, the same thing happens with the heart. This is an illustration of the heart. And for my patients who have problems with palpitations, whether it's from anxiety or whether it's from atrial fibrillation or just PVCs from not breathing properly, a lung disease, thyroid problems, it doesn't matter. If you look at the basic concept of what happens when the heart beats, you'll be able to figure out how to fix the problem if it's not beating properly. So this is the picture of the heart. This is the right side. This is the left side. The right side, the right atrium takes blood from the brain and the body. It puts it as a priming pump into the big pump, the right ventricle, which pushes it to the lungs. In the lungs, it fills up on the right side and the left side. And when the oxygen meets with the blood, it goes back into the left side, prime pump in the left atrium, gets into the big left ventricle, and the ventricle pushes out to the aorta, to the brain and the rest of the body, so it starts all over again, delivers oxygen. That's basically what happens. But the contraction has to occur in synchronicity. You have to prime up here and contract, then you prime here and contract. If you do contraction both upper and lower at the same time, then you're not going to be able to get proper filling. So it always is the atrium first, ventricles next. Atrium first, ventricles next. That's the way it should work. Even when you're with a sympathetic response, angry, adrenaline's flowing, or exercising, you're about to cross the finish line, you still, even if you're beating fast, it's still atrium, ventricle, just like that. The problem will occur if the firing is off. Now the heart should have its built-in mechanisms for resetting the pace if the pacemaker is irritated. The pacemaker of the heart is right here in the atrium. When an electric current is started in the pacemaker, it sends it down into something called the Purkinje fibers. It sends it to the next node, which is an AV node, and then that goes to the ventricles at the same time. So it starts, propagates, and sends off. But there's a small delay in the tract between the pacemaker, the AV node, and then the ventricles. There has to be delay so it fills properly. That's just the way human anatomy is. The problem that we'll get, say, with people who have atrial fibrillation is that just like this tangle of not knowing where the electricity is going, in atrial fibrillation, you'll have multiple spots all over trying to be the pacemaker. So you'll have the regular pacemakers trying to set a standard pace every second. Then you have all these other guys that are irritated. And they're like muscle. They will send off an impulse as well. And sometimes if their impulse is just as strong as the pacemaker, then a whole bunch of stimulation comes down to this guy, and it doesn't know what's going on. So this will fire off and fibrillate. So when it's not contracting properly, the atrium will go like this. They'll just not contract fully like it's supposed to as a priming pump. It'll just fibrillate. When it fibrillates, it doesn't even contract. It just almost like you've seen muscles contract if you're really tired, especially around your eye. That's what the atrium does, and it's not going to help prime the big ventricles for their job. And if that's the case, you'll be short of breath, you'll be lightheaded, you'll feel weak. So what we in Western medicine do is we try to give medicines that will calm this extra firing down, slow down the pacemaker, hopefully slow down all these other extra pacemakers. And those medicines are strong. If anybody's ever been on beta blockers, which are used for high blood pressure or atrial fibrillation, and sometimes PVCs, you won't be able to get your heart rate above 60. That's why my runners hate beta blockers, is because they can't, when they're doing their cardio workouts, they can't get their heart rates above 60, and it feels like you can try to run as fast or as high as an incline as you want, but the heart rate will still stay right at 60. And that's the problem with beta blockers. They also cause a little bit of depression, a little bit of bronchospasm in my asthmatics, but they are good. They do save lives, especially in heart failure, but they do lock this down. In the case of palpitations and atrial fibrillation, they might help. The other thing that we sometimes will do is, if it doesn't work with those medicines, the beta blockers, more medicines, calcium channel blockers, even something called sotalol, what we will do is send to the cardiologist, and he'll actually put a laser in and burn every little extra, I guess we would call it extra area of beats, so that the pacemaker can take over. And you actually will burn the lining. The biggest problem with that is you can actually burn a hole through your heart, and that's not good. But they do it to almost 0.5 millimeter specs, so it's very accurate. But even with that, I'll still have patients that come in after the ablation treatment and still have palpitations. So with that exact of a surgical procedure, I would always wonder, well, did we look at a magnesium level? Anybody who goes to see me in my lectures will usually hear that I like to address magnesium deficiency. I think America is on a bad diet in general, and I think the bad diet with processed foods just is so nutritionally depleted that one of the nutritional the lack of minerals is going to be found in magnesium, and magnesium is important for contractility, for proper firing, for muscles to beat properly, for the uterus to not go into a tetanic spasm, for muscles to not cramp up, for the gut to work properly, and even for the brain to calm down and decrease anxiety. In the case of palpitations and atrial fibrillation, I would always check on a fancier blood test for magnesium. That's called a magnesium RBC level. If it's done properly, it can tell you whether you're in the ballpark of saying you have good magnesium or whether you need supplementation. The biggest side effect with that is if there's kidney damage, you might accumulate too much magnesium if you take it as a supplement. Most people will know how much magnesium they take is good by figuring out if they have diarrhea, they're going to stop taking the magnesium or decrease it. Other things that help with contractility and muscle beating would be hawthorn. The SPICE trial was done a bit ago, and it checked for, or was studying the use of hawthorn extract in people with class 2, class 3 heart failure with low ejection fractions. And it found that people that were on their standard treatment plan for heart failure and low ejection fractions is how much strength the left ventricle pushes out. When you have a heart problem and you've killed some of the muscles in the heart, they won't have such a strong push, and that is the result of that will result in a low ejection fraction. So in the study of the SPICE trial, they found that the people with low ejection fractions within 2 years had a better outcome in avoiding sudden death or cardiac complications when they were on hawthornberry. So a very good, reliable trial, but nobody relies on it as far as cardiology, probably because it's an herb and it's not a prescription. Other things to unload are water pills. Sometimes we can go with something very mild like hydrochlorothiazide, which helps you get extra water off, but you have to be careful with the calcium that gets peed off as well. Or I've had nice response with dandelion root. That also will gently get the kidneys to get rid of extra water. If you get rid of extra water, again, it will help the heart work better. If the heart is just going through excessive beats, not knowing what to fire, hypersensitive, then I would always say stress reduction, and that's a play on words because you can't really reduce stress. You can reduce your reaction to the stress. So stress is always going to be in the eye of the beholder. So if you're in the right lane like I always am and somebody cuts you off, you can think, oh, he did that intentionally, woe is me, that's not bad, he's trying to defeat me. Or you can just say he's a crazy driver, let him go. But sometimes developing a relaxation response will help in stressors that come up during the day. If not, This pacemaker will also be stimulated by your stress response. So if you're anxious, if you are in a work environment that is highly toxic, if you can't get out of that, if you're in a bad relationship, if you have anything that's hyperstimulating, it will send the messages to the thyroid, send the messages to the kidney, adrenal cortex, and you'll secrete a whole bunch of adrenaline, norepinephrine, epinephrine, and it will also stimulate the heart, and then the palpitations will come. So stress reduction is important. Practicing relaxation response is important. Eating properly is important. Fish oil for slippery blood. Fish oil for the anxiety and tolerance to the stressors. Again, magnesium and hawthorn extract. Sometimes something as easy, and exercise is always important. Things that can help will always be medicines, and you got to get checked out and make sure there's no aberrant pathways, no thyroid disease causing the palpitations, the arrhythmias. Again, in that patient that I mentioned, he went all the way to the point of having an ablation. He was still having palpitations, and he's still on beta blockers. So my challenge would be with relaxation response, with exercise, the heart loves exercise, with practicing relaxation response, exercise, eating properly, the Mediterranean diet, the macrobiotic diet, or just an anti-inflammatory diet, you'll always decrease the possibilities for the palpitations to be interruptive of daily living. If there is an anxiety issue and there is a hypersensitive atrium or pacemaker, then you're always going to have this thing fire off, and guess what? When this is firing off aggressively, it's going to turn on the anxiety. So my usual go-tos would be what I just mentioned, in addition to seeing a cardiologist and making sure there isn't anything like coronary artery disease or a thyroid problem, which are usually found with not necessarily invasive testing, but you do have to have blood tests and maybe even stress testing